And June is Pride Month, and all month long we're sharing stories from the people in our own community. This morning, we're learning about the story of one Houston man's health journey. Donnell Walker was diagnosed with HIV in 2006. The diagnosis added to the list of other health problems that he was facing at the time. He was morbidly obese, suffering from hypertension, diabetes, heart attacks, and strokes. And now he's worked to improve his physical health and significantly enhance his overall mental well-being. So as you can see, he is joining me live this morning to discuss this. So first, just tell us about the diagnosis that really made you want to turn things around.
Once I was diagnosed with HIV, my journey started with Legacy. And with
Legacy
that,
Community Health.
Legacy Community Health Clinic. And with that, I learned more about how to manage my care. So I also found out once I was diagnosed with HIV that I had hypertension and diabetes. And I went on that journey being prescribed medication and going through therapy. And
so it sounds like you had a list of things that were going on.
Right.
What was it that made you go to the doctor in the first place?
Well, it was my diagnosis, but I was morbidly obese, and I was always concerned about that, but not enough to do anything about it.
To actually go to the doctor.
Yes, and shortly after becoming a patient of Legacy, Sean Barrett was hired as the nutritionist, and I worked with my PCP and my nutritionist to manage my weight and also my diabetes. And it has been eye-opening for me. Because I spent most of my childhood not concerning myself with my health or health management. And once I became a patient of Legacy, I was introduced to managing my own health care. And believe it or not, I've had the same PCP for the last 20 years. Sean has been my nutritionist for 11 years, and I got lucky enough to be involved with the gym there, and Felicia's been there with me. She's been there for 10 years, and I lost over 200 pounds.
Wow, congratulations.
Over 200 pounds.
So a quick plug for Legacy Community Health in case people are not familiar with what they have to offer. I mean, all of these, the facility, these really great connections that you've made with your providers, but they can also work with you on a sliding scale. If you can't afford health care, they can work with you on that, right?
Absolutely, absolutely.
And were they able to help you with that?
Absolutely. I've not been denied not one procedure since I've been a patient of Legacy.
I love that.
I have gotten my insurance intact finally, and it's all because of Legacy and their counseling and support. So I can't say enough about how grateful I am to have come through that clinic, to be in that clinic, to have been successful with so many issues. My latest diagnosis was prostate cancer.
Oh, wow. And how's that?
I am actually in that mode now, and I look at that as being successful. They removed my prostate in July of last year. I've gone through 36 days of radiation, and everything is looking hopeful. I'm being supported by my PCP, by the nutritionist, by the gym manager, and I feel successful at recovering from that.
So as a gay black man, it's difficult to, sometimes there's a lot of mistrust between the medical field and people that are gay and that are black, right?
Absolutely.
Was it difficult for you to come forward, or were they welcoming? Did they treat you well?
It was extremely difficult. It has been a journey, and I've had to, because of my being a patient of Legacy, I've had to reach out to behavior medicine, and now I'm handling therapy through all of these issues, and it's working out perfectly. I'm feeling better about myself. I'm feeling stronger. I'm feeling comfortable with who I am.
And I wanted to point out to people that the journey can be hard, because we're seeing the end result, we're seeing a happy ending.
Absolutely.
But to get there, it takes work.
It takes work and courage and support.
Yeah.
And I've gotten great support with Legacy Community Health Clinic.
And what advice would you have for the LGBTQ community who's maybe still struggling with some of these health challenges?
If you're looking for someone to talk to, I suggest that you talk to a counselor at Legacy, get involved, let them lead you through the process, but start there. Start there and take their advice, and you will find yourself in a much better, comfortable state of mind.
I think the wonderful thing about Legacy, too, was that once you were diagnosed, they handed you off to somebody else within the facility. They didn't tell you to go make your own appointment somewhere else, and
they've
you have to
never
drive
left
somewhere.
me alone.
And
never left me alone. And
that's how you're able to be so successful.
That's how I'm successful. They even partnered up with other health facilities like Baylor College of Medicine and Houston Methodist. And with that, this new MyChart system allows us all to be a team.
Yeah.
So
and you're under the best care in Houston.
The best care.
Yeah.
The best care.
Awesome.
So I am extremely successful with this because of Legacy Community Health Clinic.
Yeah. What are some of the other health challenges that you're still struggling with today?
I have glaucoma, which is because of diabetes.
Because the diabetes was so uncontrolled for so many years?
It was not controlled. And now I'm still going through and dealing with hypertension, because my blood pressure has to be controlled through diet and medication.
Sure.
And that's counseled and managed through the team at Legacy. And I can actually see the results of everything through MyChart. So Legacy is connected with technology, and it's just a big round ball of support.
Yeah. What happens when you can't pay?
When you can't pay, you talk to a financial counselor, and that counselor will help you get through. And they have so many different activities and other support groups that will help you financially. So they're integrated in the community. So if you can't pay, I think they do most of the paying because they have built support for us.
Yeah. Donnell Walker, I appreciate you sharing your success story, because I believe that it will help other people, and we appreciate you having here. We are happy for your successes and proud of you, and hope that you can continue
Thank you so much.
on that path.
Thank you.